Hi, my name is Gauree Chendke, and I'm a PhD student in the UC Berkeley UCSF Bioengineering program. I work under Dr. Tejo Desai, and my research is focused on type 1 diabetes. Type 1 diabetes is an autoimmune disease that affects 20.8 million people worldwide. In this disease, immune cells destroy insulin-producing beta cells in the pancreas, so the type 1 diabetic is unable to produce enough insulin to correct blood glucose levels. A promising treatment for this disease is islet transplantation, where you replace the beta cells that have been destroyed. These islet cells are transplanted inside a device, and this is what the Desai Lab has developed. We have fabricated a thin film porous encapsulation device that allows insulin and glucose exchange while preventing immune cell infiltration. However, a core issue that still remains unaddressed is the ischemia, or lack of oxygen and nutrients experienced by the encapsulated cells, as well as inflammation that occurs around the device. These issues lead to loss of graft mass and function over time, which is why it is important to address these issues. And that's what my thesis project focuses on. My project explores 3 different chemical and material approaches to improve graft survival and function. One approach is providing nutrients to the encapsulated cells, because providing nutrients can alleviate the stress caused by ischemia post-transplantation. To do this, I've fabricated an internal compartment that releases amino acids such as alanine and glutamine directly to the encapsulated cells. And what we see in the image on the bottom right is that after 30 days, there is a higher cell survival in vivo in the presence of the amino acid reservoir, making this a promising approach for increasing graft survival. Another approach I'm looking into is local immune modulation. I aim to do this by installing surface topography or surface features on the cell encapsulation devices, such that they will interact with the immune cells and activate them to their less inflammatory phenotype. For example, I have added these circular pillars onto the encapsulation device membranes and seen that there is a lower expression of inflammatory markers and a higher expression of anti-inflammatory or reparative markers in macrophages, which are immune cells, making this another potential approach for increasing graft survival. The last approach that I'm looking into is to increase vasculature around the device prior to inserting cells. By doing this, we can also alleviate the ischemia experienced by the cells, since they will have a source of oxygen and nutrients already present thanks to the vasculature around the device, and the initial inflammation around the device will have already resolved. In this approach, I implant the device in mice for 14 days, and after the vasculature has developed, I will infuse the cells inside the device and monitor their survival for 30 days. The results from this approach show great promise, as we see 70% graft survival in vivo. Although further studies are still underway, the use of any of these approaches to enhance the local microenvironment around the cell encapsulation device can truly advance the treatments available for type 1 diabetes and further our understanding of how to design better implants for other diseases as well.